Dear colleagues, I'm very happy to introduce you to this new IPA webinar. It's part of a long-term project organized by the website editorial committee. The aim is to create this new space, a virtual forum for development and transmission of psychoanalytical thought, as well as to foster an interregional dialogue among IPA members around the world. Today we are going to hear about family and couple psychoanalysis. As you might remember, we have another webinar on this same topic recently, but this time it's going to be centered in a very specific line of thought, the theory of link. In River Plate psychoanalysis from South America, this theory has developed greatly and created an important body of knowledge with very specific concepts about how subjectivity is affected by the presence of the other. We call, in Latin America, in Spanish, we call links vínculos. As far as I know, we don't have an exact translation for this word to English, at least in the very specific connotations it has for us. The theory of links, you will see, is centered in on unveiling what is going on between the subjects, not only within their internal world. The conception of mental life is not a closed monad, it's an open, active, permanently changing structure. You see that interaction and complexity are two pillars of theory of links. Well, now, and before introducing to the panelists, I'll tell you very briefly how we are going to work. This webinar has, as always, two sections. In the first section, we'll hear a brief introduction by the panelist. In the second one, we'll have a question and answer slot. You'll be able to write your questions along the whole course of the webinar. They are going to be answered, of course, in the second part. Remember also that this is an open dialogue. All of us, panelists and the attendees, are responsible for their own opinions. Well, now is the moment to hear to our panelists. Firstly, I'll introduce Dr. Elizabeth Palacios. Welcome, Elizabeth. I'll read briefly, before she begins, about her extensive experience in this field. Elizabeth is a psychiatrist and a psychoanalyst. She's a full member of the Psychoanalytic Association of Madrid and of the IPA. She's the president of the Aragonese Association for Psychological Research of Children and Adolescents, Zaragoza, Spain. She's the co-chair for Europe of the Family and Couple Committee of the IPA and director of the review Psychoanalytic Thinking. So, Elizabeth, are you ready?
Yes, I'm ready. Okay, so as Ines was saying at the beginning, we will go into what the link theory has to tell us about. But I will try to do some historical work or some historical going into ideas for you to listen afterwards to Janine Puget. So this webinar addresses a very important subject, which is of interest for individual adult psychoanalysts, for analysts working with children and their parents, as well as for analysts working with couples and family. It opens the possibility for discussion on the multiple ways of thinking and the many concepts that need to be thoroughly understood in order to build a substantial theoretical and methodological corpus of knowledge and practice for dealing with links in clinical work. We have been collaborating in an IPA committee on family and couple psychoanalysis for several years now, with David Scharf as chair and with a co-chair for each IPA region with members and adjuncts. And this group initially started in 2008 during Claudio Lax-Aceric's presidency as an IPA working group under the leadership of Isidoro Berenstein. The aim of our committee is to make these different psychoanalytic perspectives come together to promote an interesting and enriching clinical and theoretical dialogue with analysts interested in the work with couples and families around the world. We have been organizing meetings and international congresses, and we have already had two, one in Buenos Aires, another one in Madrid, and the next one will be in February in Naples. And so far we have published 2 books, and a third one is coming soon. So, when we use the term link to name a relationship between 2 or more subjects, it implies that we consider that there is an unconscious organization that's taking place between them, and that a sense of belonging takes place between the members of that structure that they build together. The area of that structure that they share is taken hold by a narcissistic investment, but there is an area that cannot be shared and will never be shared and could bring disillusionment to the members of these structure. Historically, psychoanalytic theory has viewed couple and family relationships from the vertex of self-object relations, motivated either by drives or by the need of attachment. An embryonic notion of object relations is already present in Freud's papers on identification and in his metapsychological work in mourning and melancholia. The concept of object relation is next referred by Abraham and by Melanie Klein's ideas on laws and mourning, and Klein gives rise to a new way of thinking within psychoanalysis, thinking the mind and its mechanisms and stressing the importance of the interjection processes, the ego structure, and the integrated nature of the objects within the infant's mind. From the Kleinian point of view, all psychic activity follows unconscious fantasies, which establish a logical structure that organizes and codifies experience, and the internalization of experience with these external objects constitute the internal objects. These internal objects form the foundation of psychic reality. This is something we know for a long time. From this perspective, interpretations of the external world will come from this internal source, and the type of relationship that the ego will have with the external objects will depend on this. Each subject lives inside different characters in an internal family and interprets the outer world experiences in the light of these internal object relationships. Objects can be considered independent and be felt to have their own existence as part of an external world after the depressive position. However, they are always at risk of being damaged or being lost. Couple and family psychoanalysis inspired by Kleinian and post-Kleinian, such as Dix, Pincus and Dare, the Scharfs, the Tavistock, the people working in the Tavistock, follow these ideas. External objects are considered then mere conjectures, cloaked by projections, and according to the potential each subject has of dealing with his own anxieties, he will be able or not to conceive the external objects as independent, as unknown, and to develop the desire to gain knowledge about them. But the notion of link does not have to do with these ideas. This notion is highly polysemic in psychoanalysis today, meaning different things according to the psychological context in which it is formulated. Initially, the concept of link became significant in the history of psychoanalytical ideas when the need to understand how another mind played a role in the development of a new mind could not be explained with the terminology analysts had at that time. So along the 60s, Bion's and Winnicott's theories attempted to address this need. Bion described the presence of another mind as necessary to receive and to metabolize infants' emotions so that they could be turned into psychic material that would help the new mind to think and dream. His formulation means that the link is mandatory to acquire the capacity to deal with emotions. The notion of the link became a central axis of his theory, and his ideas on the symbolization of the missing object and the role of the link with the mother in this process are original notions. Winnicott's hypothesis on transitional objects and transitional phenomena also gave way to important discoveries in psychoanalysis. In the 60s and 70s, some psychoanalysts started to consider the idea that certain types of interaction could cause discrete mental illness like schizophrenia. Colleagues, especially dedicated to the work with very ill psychotic patients like Frieda von Reichmann and Theodor Litz, among others, schooled in Sigmund Freud's psychoanalytic treatment precepts, went beyond these to treat types of patients suffering from severe breaks with reality that Freud himself and most psychoanalysts considered untreatable. Nearly at the same time that this was happening in North America, some Latin American authors started thinking the family and the couple as a group. The couple of parents and the family was thought by Pichon Rivière as having a defining role in the individual's psychic constitution, and the concept of spokesperson as the most mentally disturbed, which was considered an informer of what was going on in the family group's dynamic, was developed. The Oedipus complex, or the Oedipus configuration, began to be thought as external to the individual subject. The family structure was then considered to be important in diagnosis, prognosis, treatment, and prophylaxis. Another Argentine author, Garcia Badaraco, studied how a psychotic mind could be created within a family, and that the non-resolution of the Oedipus complex in one generation was repeated in the next. The mother with such a non-resolution would establish a narcissistic pathological relationship with a child, trapping him in a symbiotic link that excluded the father. Ill members thus turned out to be considered emergents of a pathological family dynamic. And as you see, we are already here in River Plate or Rio de la Plata, with all these authors. Some other authors try to study the suffering everybody has to undergo through their involvement in shared links. Suffering in the link is a notion that tries to describe the psychic pain, distress, or affliction as a result of being part of shared links in couples, families, institutions. Many authors from both within and out with psychoanalysis have tried to investigate and explain how an individual person is shaped by the group to which he belongs. Janine Puget, that you will have the possibility to listen to her in a few minutes, and Isidoro Berenstein did a lot of work on these notions and coined some others, which are new concepts that need to be given some further thought since they open new ways of thinking within psychoanalysis. The idea that subjects live in several worlds, not only the inner world with its representations, but also an intersubjective world and a social cultural world that determines social identification and make us be subjects of our times, is an example of this, of these uh, terms and these ideas that Isidoro Berenstein and Janine Puget have coined. As you can see, these theoretical approaches, these last ones, use the concept of the subject. This means that they are thinking about a link between subjects. Some decades ago, psychoanalysts began to talk about the subject and the subjectivity. These terms had not been used by Freud in his writings, and before these concepts came into use, analysts talked about the self, the identity, or the constitution of the psychic apparatus. We still do this. The concept of the psychic subject began to be used instead of that of psychic apparatus for some analysts. And the subject was a term that was used in other areas of knowledge, such as philosophy and psychology. The concept as the subject is used in psychoanalysis refers to the specificity of each human being, which makes him totally different to any other human being with a personal history that provides him with a radical difference which can be studied in the transference in the analytical field. This is the subjectivity with which psychoanalysis deals. Jacques Lacan imported that notion into psychoanalysis from Martin Heidegger's philosophy and the linguistic Ferdinand de Saussure, but all these very interesting notions would need of another webinar. Just to synthesize, to make a conclusion, we can say that we are inhabited by objects relationships. Each of us is inhabited by objects relations and by links with others. So this is the end of my presentation.
Thank you very much, Elizabeth. You have given us a very thoughtful and in-depth revision of different perspectives. Now it's time to introduce Dr. Janine Puget. I read you briefly a brief outline of her biography. Janine is a medical doctor, psychoanalyst, emeritus professor, and ex-director of Couple and Family Master at the University Institute of Mental Health. She's a full member of the IPA, of FIPAL, and of the Psychoanalytic Association of Buenos Aires. She's the director of the Department of Family and Couple Psychoanalysis of this last association. She's one of the founders and an honorary member of the Argentine Association of Psychology and Group Psychotherapy. She's authored numerous publications in national and international journals. She has also authored and co-authored many books. She received the Sigourney Award in 2011, and finally, I would like to say with great pleasure, her most recent rewards. This year, she had been named Doctor Honoris Causa of the University of Buenos Aires and of the San Luis Faculty of Psychology. Our congratulations, Janine. So now, Janine, are you ready?
Yes, I am.
Okay.
I begin.
We hear you.
New everyday problems and tools in couples and family psychoanalysis. During one of the last webinar encounters regarding new tools, it seems that we had just becoming aware of how technology creates new problems and in some way emphasizes the importance of learning how to communicate with our patients, and this webinar, Family and Couple Psychoanalysis, also brings the possibility to investigate the tools we need to discover concerning links. Some patients know and use a language from which those new values, new rules appear. Something happened in the world and obliged us to be able to accept that some walls of our theoretical and clinical corpora have fallen down but do not disappear. They just don't occupy the same important position than before. Fallen walls, encounter as a whole, encounter and multiplicity. Fallen walls have to do with all those which avoid the radical otherness and alienness of the others, as well as the unpredictability of any encounter. They concern, for example, transference and countertransference, identificatory processes in their various forms, the recording of past history, the prediction, introducing the specific meaning of links leads to highlighting the importance of radical difference in capital letters as a necessary concept which is related to multiplicity. Dealing with what happens when two or more subjects establish a link concerns the work which emerges from the space in between, which is this unavoidable empty space that increasingly separates the members of any link. And that depends on the effects of a presence, creating a new concept called presentation, which differs from what belongs to the order of what we name representation. Because I think representation is a concept in crisis. The specific meaning of difference. Radical difference is the basis of what I call a link. Consequently, we discover what members of links do to avoid the work of recognizing the otherness and alienness of the other, and the effect of the increasing separation of each member. Any hypothesis which reduces the otherness to similarity or complementarity will avoid the linkage work based on the effect of the presence, since the presence of the other is always an excess, which disturbs the organization of the inner world of each one. Of course, couple and family psychoanalysis give us the opportunity to highlight the struggle between the same and the always alien. What I have learned working with couples and families. Little by little, I became aware that even in individual psychoanalysis, the work that emerges from the radical difference must be taken into account as a constitutive part of the relationship between analyst and patient, which doesn't concern only transference and countertransference. The psychoanalyst will have to deal with two overlapping logics, one of the inner world and one of the linkage. Elizabeth also already talked about this before. In one of them, crude otherness can be avoided, and in the other, it's impossible. To work with the complexity of links as it happens with family and couple psychoanalysis has to do with the difficulty to accept the unavoidable otherness and alienness of each one. This is the richness of the link, and it also requires that they accept the other will never be a complementary part of oneself, nor a similar part. The majority of conflicts have to do with that kind of suffering, and the major complaints and sometimes violence emerge from this. That is, for example, a need to accuse the others, whoever they are, because they don't fulfill the necessity of the subject. And in the family structure, it's very difficult to accept that the link is not only based on complementary function, but should be also based on the necessity to recognize that being together requires a permanent work which allows to awaken curiosity and accept the unpredictability of each encounter. So the main suffering is, why did he, she not tell me? Why does he, she never do what I expect? Why is it impossible to go back to the first love? Why, and so on. Little by little, the members of a couple or family have to accept the disappointment and the discovering of belonging to a space created by them, but which doesn't respond exclusively to the rule of what happened in a structural system. They have to move along without the support of identificatory processes and complementary functions. They also have to discover that they never know the other forever. Knowing is a continuous discovering. He or she was so kind when we first met. When our first baby was born, it was such a delightful experience, and now it's such a disappointment. Our family life is so complicated, and so on. Our sexual life is also so complicated that it tends to disappear. I feel alone when we are together. That is worth being alone. We have no time to talk. The other day we went to a tea room to talk, and we realized that we had forgotten to do it. And doubtless to be alone or to create a link awakens different feelings. Couples and family give rise to very complex situations in which the unpredictability is a necessary condition. By analyzing couples and family, we become aware that the emphasis must be placed on what they do together to create a dynamic relationship. Listening to the others is always surprising, or it should be. In consequence, we have to look for what they are able to do together, as well as for the effort they do to look for single definition, placing the others in a complementary position or similarity instead of discovering what stimulates curiosity and therefore the desire to meet. Interpretation and intervention. I hypothesize that we need to find a new sense to what is happening, and here we have all kinds of interpretation depending on the frame of reference of each psychoanalyst, as already Elizabeth told us. But also we have to be able to formulate intervention which have the purpose to give room for thinking together, that is, with patient analysts thinking together. On some occasions, patients could tell us, that is not what I think, or what we are talking about. And I will object to that, of course. This is not, this is how I listen to you, and I listen to what you say. My purpose is to lead families and couples to becoming aware that it's impossible to avoid conflicts, but it's possible to become friends with them. However, the patient has to awaken what should sustain a link, that is love in capital letters. And what love means. My work consists of helping couples, families, and individuals to become friends with conflict. And in the majority of cases, I observe that is not what is happening. All that surprises is quoted as a disturbance. And on the other hand, if we cannot accept the alienness of the others, life loses part of its vitality. Thank you. I don't listen to you.
Thank you very much. Your words are full of thought-provoking concepts. Now we arrive to the second part of our webinar. There's a lot of questions and answers. I didn't receive yet questions from you, the attendees, Please remember that you might send them by writing on the box at the right side of the screen where it says questions. Meanwhile, maybe the panelists would like to add some comments on your ideas or to initiate the dialogue between you both. Meanwhile, we wait for the questions from the attendees.
I think what Elizabeth told us is very important because she gave the possibility to the audience to learn about the evolution of the concept of links and the different way to work with this. And maybe it's quite disturbing, and I accept that my point of view may be very disturbing.
Why do you think, Janine, that this is disturbing?
Because it's not classical psychoanalysis. See, when you don't speak about object relationship, and you speak about earliness and otherness, and you, it seems it's not psychoanalysis. If you don't go through the evolution of the mind innerward, and you give a special space or special place to the link by itself, not as a something which emerged from the inner world. I think I have the experience to be a question about that point of view.
I think this is very interesting and very important because I think that the ideas that you bring in add something which is very important for analysts to take into account, even if you're an individual analyst with a patient, because we are so much used to thinking about representations and projections that we don't leave a space for this other part of the relationship that takes place, in which having an analysis with an analyst is not the same as having it with another analyst. And this has to do with these differences that come into the link.
I interrupt now to the panelists because we are receiving several questions. The first one I read to you.
Who is
Wait
you?
a second.
To both of us?
To both of you. The question is to know more about what does it mean that representation is in crisis, the theory of representation.
I wrote about crisis of representation a long time ago, and I spoke of that in a congress in San Francisco. I think representation is, as Elizabeth began to talk about, always talking about the denial of some reality of the subject, of some aspect of reality of subject. Representation is always something which we had before, and we realized again. I mean, it's not a presentation which astonish, which are surprising, but it's something you already live and live again. And so you don't take into account the present as a new possibility. And that sometimes leads people to say, that is something like we lived before. Something like, I recognize because I have some historical knowing about what you are talking about. And I think we are avoiding what is surprising. I think present is always surprising, and you can't refer it at the past experience. Instead, representation, you can always referring to a past experience. I don't deny the importance of representation, but I just think it's not occupying the central place.
Well, I think this is very important because when we think about representation, this is something that we know in psychoanalysis and we cannot throw it away. This is part of important knowledge that we have acquired within our being psychoanalysts. What I would say is that I would add this that you say, Janine, this that the presence is very important and the effect of presence is very important, but always keeping as important concepts the ones we already have. I would add these you give in.
Okay.
Thank you to both. Now I'm going to read challenging questions. How could we define love?
Do you want to answer, Elizabeth? Or?
Yes, please.
Go on, Janine. I will try to answer something to that as well.
Love is a very difficult concept, but what I am thinking is concerning Badiou and Badiou concept of categories, very important categories, creating new categories of truth. That is, love is one of them. Love as a concept which is important if it creates all over the time the different categories of truth. When couples say we love each other but something is going wrong, I think they don't not working through the concept of love. Love as a first love is not necessarily the concept which make you able to go through a link to the all everyday new ideas what arouse from the living together. So they say we love each other. What does you mean when you love each other? If love is not capable to give rise or to create new possibility in the link, it's not love. It's just quietness. And love is not quietness. Love is always thrilling. That is what I imagine. Maybe Elizabeth
yes, we should have to make a definition of what love really is, but because falling in love is something that has to do much with narcissistic work, something that we're cloaking with our narcissism onto the other, and then we can say this is not the person I really thought it was. So really thinking about love is going into the alienness of the other, being really able to know the other and to construct something with the otherness of the other, not with what we are projecting onto the other. So really that is a very important thing, the truth of what's going on in that link.
I am thinking when you say falling in love in English, in Spanish we don't have this word. It's very important to say fallen. You fall, something falling. My walls are falling, and you fall in love, and something happened in your life. It's an encounter, but after that you have to do something together. It's not a passive word; it's an active word.
Well, and that is a beginning that we don't know how that will go on. If you're able to construct something, to build something in between those two.
And that is love. If you are able to construct. If you're not able to construct, it's love is just a passive word.
Another question somehow connected with this. Can wanting complementarity in a couple not be a healthy wish? Good evening from Romania, and thank you for this webinar.
Yes. Complementary function is sometimes pleasant because if you need something, the other will have to give it to you. But that is not love. That is just an adjustment between your need and the possibility to receive. It's quietness. It's good. It's pleasant. If you have a headache and you need an aspirin, it's nice if the other give you the aspirin. But this is not exactly love. It's just a complementary function. So love is exactly to be able to create new necessity, even new struggle, new difficulties, but difficulties which are very important and very creative, able to create new desire to be together. The worst is when you meet and you don't have really the curiosity to know what's going on for the other, because you already know it because before he told you something and now you know exactly what you are waiting for. When you receive exactly what you are waiting for, it's maybe pleasant, but it's finished in this moment. So imagine when I answer your question, I will not fulfill what you are expecting, but maybe open your mind.
Well, the thing is that this is what happens with many couples, that they are looking for something which is complementary and they don't find them. And this is what makes you suffer in the link.
Exactly.
Not being able to find that complementary situation, which we could say that is not the best situation, the complementary situation, because if not, this is like death.
Yes. It could be pleasant, but it's not enough.
Well, another topic. Is there a difference between the concept of link in Bion's work and that of link vínculo as it appears in the Rio de la Plata school?
It has nothing to do one with the other. They come from very different theories, and they mean something totally different. So there isn't something that we can follow. The notion of el vínculo in el Rio de la Plata, and coming from all the studies done and all the work done from Pichon Rivière and all the other work done by Isidoro Bernstein and Janine Puget, they have nothing to share with the link in being or in theories coming from there.
Maybe
but I guess Janine might have something more to say.
It's okay. It's okay what you said. But that is why I spoke about two heterodoxal logics, two different logics. One of the inner world and one of the link, as I suppose the link is. So they are not possible to imagine some similarity between one logic and the other one. And this is a big difficulty for psychoanalysts, for all of us, to choose with which one we, we interpret or we speak with the patient, because one is not the other. One is inner world and the other has all other values and rules which are not comparable. So I think for a psychoanalyst, he will never be free or satisfied when he give an intervention or interpretation, because he will just take an aspect of the problem and not the other. Instead, in the Beyond, for example, scheme of reference, corpus of reference, he could feel, I imagine, satisfied when he understands something of happening in the inner world. Meanwhile, I will never be satisfied when I listen to a couple of family or even in individual psychoanalysis, because something is always lacking. Is it understandable what I say?
Mm-hmm. Nevertheless, I was thinking that, of course, we are addressing authors that they were able to think concepts and ideas in the 60s, in the 70s, and this is how our theory, our psychoanalytical theory, has been constructing, thinking new things and trying to give names to different things and bringing in new concepts. Um, this is why we have many words or different concepts in psychoanalysis which are very polysemic, that we are using one word which means different things in different theories. What I find very interesting is that the idea that we didn't have so far in psychoanalysis is the possibility of thinking what happens with what we don't know of the other, because constantly we're trying to do something with that, not to completely take in that difference the other is bringing in. So all these concepts that you bring in, Janine, are interesting in this sense. The same as Bion was looking for a notion in which he could uh, try to give an explanation of how a mind was being built up. Now we're trying to bring in an explanation that tells us how the difference of the other can be brought into a link.
I think the big work we have to do is about concerning difference. Difference is a very difficult concept, and maybe we need to ask help to philosopher who knows more about difference than what we know as psychoanalysts. But that is to work through along the time.
Well, we'll pass now to other two questions. I'll join two questions because there are links between them somehow. One was the request of hearing some clinical vignette, and the other is if you explain, how could you explain links in a perversion structure?
I don't know what they mean by clinical vignette. They want to read a clinical vignette, or what do you mean?
It was a very global or general demand of here some clinical examples, and so I joined it with one more specific question on perversion structure and what you think about links in that clinical cases.
I thought when I give some example of what happened in a session when patient complains about the other which not fulfills the expectation or with all the complaints, it was a kind of clinical vignette, because it's very often we have this kind of of, of question, of way to talk about, to imagine what is a psychoanalytic session for a couple or family, and complaints is a very special way to talk with the other. Why you are not as I imagine you have. So we have to work more, or to investigate more about what means to know the other. Because sometimes even psychoanalysts say, I know my patient. We never know the other. We are ongoing the work to know each day what's going on, who is he, and how we make a link with the other. So I think we have to think when people say, I know my husband or my wife, I know my children, what they mean. And what they mean is they just interrupt the process of creating a link because they imagine they know, and we can't know the other. We are ongoing the process of knowing, and the process of knowing is infinite. It doesn't finish. We know each other because we do together things that is today and not the same tomorrow. So when some patients say, I know what's going on, I will say, what do you know? What do you think? I don't know if I will say that, but I say something like that. What you imagine is knowing the other. So I don't know about specific perversion, couple perversion, but the same we have to do. We have to see or to listen, to be able to listen how they manage to be together.
I was thinking, of course, we haven't brought clinical vignettes of a specific case, but I was thinking of the many cases that we have with very narcissistic couples in which they ask the other exactly to be what they need them to be, and all the conflict comes out of that, not being who you need to be, who I want you to be. This The more the couple asks for this, the more the couple is a narcissistic couple, the more difficulty they have to be able to recognize the other with its differences. For example, I was thinking, I mentioned when I told the ideas I brought at the beginning, many authors or many psychoanalysts that started working with very ill patients, and especially with ill members that came from families with difficulties, and mothers saying, I know my child, I know exactly what they need, as if they were transparent. There is a total difficulty there to see the otherness of the other, even in a mother with a psychotic child. So that would be the situations in which the link is at suffering the most, is we're not being able to have linkage with the other.
It's exactly what I think. The impossibility to recognize that you don't know the other, you will never know the other. We always be expecting what he can give you, but what you are expecting in narcissistic modes is not the otherness, but the similarity. And maybe that is a perversion of the linkage construction. It could be thought like this, but that is a new concept of perversion. For
Yes.
the inner world, it's one name, and for this linkage, it's another name. And we have to get aware that we can't use the same concept for linkage and then for inner world. And that is a big difficulty in psychoanalysis. So that's why radical difference is a very new concept for linkage structure.
Another question in the same line. I'm deeply interested in this presentation. I agree on the fear and even hate of otherness and the difficulty of accepting that the object is always another. But Why do you say that this is so different of classic object relation analysis?
Well, I will try something, then you go on, Janine. I think that this has to do with where you put the point, or where you look at. If you're looking at the object's relations, you're looking at what comes from the inner world and cloaks the outer world. If we are talking about this other perspective, the link, we are trying to see what is the work you're not able to do because you're cloaking the other. So the where you put your point in the observation, it's different.
I think
But
you
I
give. Yeah, yeah. Go
sorry,
ahead.
no, go on.
No. I think you give a very exact definition, but it's very difficult to accept that it depends on two logics. I insist with the two logics, because of course object is not subject. Object is from the inner world, and subject is the other. The other's absolutely other. Other with all the characteristics we talk about, Elizabeth and I, and myself. That is the unexpected uh, dialogue, since you are doing it from the link in the linkage structures. It's not a structure situation. An object is an inner object. You know it, and you are knowing new characteristic of this object, but it's not really the new one. It's a transformation of the old one, and transformation is not new. It's difficult to accept the fundamental new of the object, of that is not the object, that is the subject. I insist with that because I think we imagine that we can know the object, and we cannot know what happened in a link. It's always something different,
I think that
unexpected.
mhm. I
Yeah.
think
So,
that if we try to make some intellectual work on how notions came to be built and constructed by different analysts and are part of what we have as theory. The notion of object and internal objects, and how internal objects are created through primitive mechanisms, uh, has nothing to do with the idea of trying to find the difference in the other. Although, in that theoretical background, you can also think of having a mind that's able to pinpoint differences and to learn about differences. But this is how I told when I was talking at the beginning, that we are not in that mental state constantly in which we can see the difference of the other, because we're all the time using our projective and introjective mechanisms. So, but these are two concepts that are built in a totally different way, coming from two very different theoretical backgrounds. So that is why I understand, Janine, that you use this concept of the two different logics, because it's really two different ways, totally different ways of building up notions.
yes. Different concepts. You have to create new concepts, new listening. You don't listen to the same thing. If you are talking, or your position is to investigate what happened in the inner world and in this dialogue in between two or more persons, both are important. I'm not denying the importance of inner world, but I am disturbing with this linkage point of view, because I never know what to listen. Do I have to listen what they are avoiding, or do we have to listen what is the introspection of the inner world? So I think it's a dilemma, no?
Another question, also connected with this. Do you think that at the very extreme, the intersubjectivity denounces categorization and normalizes every behavior, even not relating as such, especially in couples?
I don't understand very well the question, do you?
No.
I read
Maybe
it
you
again.
can repeat it?
Yes. Do you think that at the very extreme, the intersubjectivity denounces categorization and normalizes every behavior, even not relating as such?
I imagine this question, but I'm not sure I clearly understand it. That imagine that intersubjectivity theory will be enough to understand all the behavior of the human being. As Elizabeth told us, some relation in intersubjectivity theory doesn't need the radical difference and what I am talking about today. It's just a very specific way to give rise to new possibility to talk about how the subject uh, is able to connect itself with the other, and maybe with Freud's theory, it will be enough to give rise to the possibility to create the social subjectivity of a subject as a transformation of its first relationship. When it is transformation, that is not new, not really new. It's transformation of something you had before. So the newness of this relationship, as we are talking about today, is not a transformation of something you had before, but just something specific and new. Maybe I don't know if I understood very well the question. Maybe you
I
did.
think that the question has two parts. No, a first part. Can you repeat the first part, please?
Do you think that at the very extreme, the intersubjectivity denounces categorization and normalizes every behavior?
I don't know really what this person listened or what we said. No, this part of normalizing, we at least I don't work with normal and non-normal with the concepts of something that's normal and not normal. So I don't exactly understand that part of the question, but what the first part of the question, in which concepts need more understanding, or we need more understanding of all these new concepts. And this is something that I said at the beginning. No, at the beginning I said that to thoroughly all these concepts opens us to discussion on the multiple ways of thinking, and that we need to build a substantial theoretical and methodological corpus of knowledge, because there are concepts that we need to understand. As you see, all the questions that we have just had, they try to address, to make differences with what we know and the new things that come in. So I think that, of course, we need to go understanding more all of this, no? And this really brings a shock into what we already had as the classical or the well-known psychoanalysis we all have been trained in.
I think it's important we didn't understand right away what the last person asked, because maybe that is a struggle for us. We are talking about a new way to think, and I imagine all of the persons who listen to us are trying to do something with what they know and what we are saying. And sometimes it's difficult to not to be able to associate with what you know, because something new is disturbing. So you say, well, it's more or less the same as what I know. And maybe it's not the same as what you know, but just need to take time to listen to something new.
Mhm. Well, this is something we always do when we listen to new ideas. We try to gather them with the ones we already know,
Exactly.
if they're adding knowledge or not.
Exactly.
So I think it's not an easy task for any of us to open up to new ways of thinking. It's a hard work to be done. This has to do with links and with the differences.
That is a good example, because
Yes.
we had difficulty to understand. Maybe why not? We don't have to understand everything.
Wait a second. This is a different problem. The question says, I'm a psychologist in Uruguay and moved to the States 20 years ago. Yet it's sorry, it's not considered as psychoanalysis. It's a complaint that they have no framework or the no possibility of received a framework in the States to this uh, possibility of working with couples. I read it again if you want.
Yes, please.
Yes.
Wait a second. I'm a psychologist in Uruguay. I moved to the States 20 years ago. Yes. Here it's not considered as psychoanalysis. Working with family and couples says that, at least in that place, is not considered yet as psychoanalysis.
Well, there's quite a bit to say about that. Um, uh, Working with couples and families has something that most of the people that we have been doing this work was outside IPA. This was not considered, and it's still not considered for many psychoanalysts as true psychoanalysis. I think it was very important when Claudio Laxeyxeric gave the possibility of having a committee or a working group initially for couple and family within the IPA. And this was in 2008, and we have been working on that. And we're still working on that. We are not giving this place as true work, as if the true work would be with the individual patient, not with. I know this is not the same in all the IPA regions. In the different IPA regions, couple and family psychoanalysis have a different space. So I understand this person from Uruguay that, of course, I'm sure that when she came to Latin America, she found that there was a space for this, to be able to think this. This is not the case in all the IPA regions. And we are working on that. We are doing work on that. Because I think that psychoanalysis has a lot to say about this.
I think this webinar today is something which has something to do with IPA, because it's IPA webinar. And it's important that in those webinars, we have twice today, that's the second time, you have a special session for family and couple psychoanalysis. Now, I'm not in a hurry to give a place to psychoanalysis, to, to be considered psychoanalyst as family and couple, which I think we have to build a frame of reference, not in a hurry, but little by little, which will be, give the possibility to confirm that that is psychoanalysis. But for psychoanalysts, when you don't speak about object relationship, inner world, unconscious, transference and countertransference, and you don't refer to Freud or some other psychoanalyst already accepted, it seems you are not psychoanalyst. So I don't mind not to be considered until now psychoanalyst because I feel I am psychoanalyst, but I want to define what means to be psychoanalyst. It's just to repeat what we received before, because it was very important when Freud made his first discovery, and other psychoanalysts also, or we are able to do something in this actual world, the world of this time, and learn all the new forms of relationships people are able to create. And what I say in the beginning of my talk today, the new language which appears and which needs from us new categories to listen to people. I think if we go on listening all with the old theory, psychoanalytic theory, maybe we are going, undoing a very bad evolution. And I think we have to learn what otherness offers us to talk, to think, and to lead with that, because it's not easy to work with otherness and alienness in a psychoanalytic session. So we're not in a hurry, but we have to be able to make a definition of psychoanalysis related with all those concepts we talk about, Elizabeth and I.
So I think it's something to take very much into account that we are also thinking of what is the future of psychoanalysis. So I think this is a very interesting field and an important field for the future of psychoanalysis, really to be able to build up a theoretical, an important theoretical background to all these work we're doing. All the people I mentioned, all the analysts I mentioned, while I was bringing in my first intervention, all were psychoanalysts doing work with their psychoanalytical ideas and trying to see if they could open up to working in different other fields. And this goes back to many decades ago. So I think it's an important field also for the future of our work.
Yes, it's very important what you said, because we are talking about the future, and in last webinar we've talked also about future, but we were very pessimistic about the future, and I'm very optimistic about future if we are able to take into account what is going on, and to learn new languages and new values and new rules, and not as forbidden new rules, but very good new rules we have to create or to learn from the young people. I think we have to learn from the young people. They know what we don't know.
Another question about possibility of changes. Would you say that your experience as couple or family analyst has changed the way you listen to your individual analysis patients? It had happened to me, and I would like to listen to your experience.
It has happened to me. Working with couples and family also brings a different way of listening to the individual patient. And I'm a child analyst as well. A different way of listening to the child, to what the parents have to say about the child, to the differences the child brings into a couple. Yes, I think it definitely it has made changes in my mind. Yeah.
I could say it's also changed my mind without any doubt. But when I first began to study psychoanalysis, I studied simultaneously group psychoanalysis and the classical formation for a psychoanalyst. And I was always taking into account that the other is not the same when he is in a group or in a linkage situation and when he is alone with myself as psychoanalyst. And I've always had this kind of struggle inside myself when I thought, is transference and countertransference enough to understand what is going on in a relationship, whatever it is? Of course, in the very beginning, I didn't know exactly how to manage with that. And it was, since it was not classical way to think, it was uneasy to do it. Then, little by little, I got stronger. I didn't care about what all the institution thought, but I tried to do by myself and accept that I had to do with two logics, as I began to say, two separate logics, and to invent or to create or to imagine new concepts to give rise to one and the other. So I listen different things. When sometimes a patient say, I know, I think, what does he know? Or he complains about the other. I don't think exactly uh, using the introjection and projection identificatory processes, but sometimes to give a place to the real other and say and analyze why is it so difficult to accept the other is not as I think it is. He is. So I think, yes, my individual uh, way to think in psychoanalysis open a lot of problems, much more difficult than when I just have to lead with identification processes and projection. I think it's more difficult. And when I feel I'm not only a transference object, but I am another subject here in the consultation room, how I speak to when I am a subject, when I am interpreting the inner world of the other. So I hope everybody will try to work with couples and families.
Well, when we work with an individual patient, it's also a couple, a different type of couple.
Of
And
course.
there are many analysts that have been trying to address what happens in that field of
Exactly.
interaction. Not only not only transference and countertransference, but something else happens in that field, and we
Exactly.
can add this radical difference that goes on, and how to address this.
I think maybe I spoke about radical difference maybe it's not a very good way to speak about difference, but I didn't found another way to, I didn't found another concept. So I use radical difference. I think we have to invent, to create a new concept about to talk about differences.
Another question. Now, we heard about love. Now, and the hate, how we could define it in a violent world like ours? How we could define it in a violent world like ours?
In my way of talking about love, it's not the opposite of love. It's a category in itself. Love is something, and hate is another feeling, a way of of result of different elaboration of what is going on. But I don't think love and hate go together. It's not the contrary of love. Love is a specific category, and love is a mechanism or something we have to, which give, which happen when something is going wrong in a relationship. But we have to give a specific place to hate, a specific place to love. In psychoanalysis, it's sometimes thought as a contrary love and contrary place to hate. And I don't think it's my way of the way I will think about love and hate. I don't know what you think, Elizabeth.
Nevertheless, hate has to do with something that the other cannot be taken in, and the other has to be damaged or left aside or left without life. So in that sense, the other cannot be considered in any way just as someone to be left aside or to be damaged profoundly.
Maybe the interruption of creating a link, the impossibility.
No possibility of creating a link.
Yes. But that is a good example of the difficulty with what we are talking about, because love and hate in classical psychoanalysis go together, even in opposite forms. And now we are talking of a new category named love, which is not the opposite of hate. That's what you say. I agree with how you, Elizabeth, told about hate. The impossibility to accept the other, and in some otherness impossible to accept.
And not being able to create any type of link in that sense.
Exactly.
And this, of course, has much to do with the violence that we see in our world. That is completely violent towards the other.
Yes.
I'll read now to you another question that insists in one of your central concepts. I would like to understand more about presentation and where the concept appears in metapsychology. I would like to understand more about presentation.
This is a concept that doesn't appear in metapsychology. We have to build up that. what we know in all our psychoanalytical concepts that we've been trained in, is representation, not presentation. So this is a new metapsychology we would need.
I think we are trying to construct, to build a new metapsychology related with linkage. In this new metapsychology, presence is not the opposite of representation. It's a new concept. Present is something always new, unknown, and with the quality of otherness, unavoidable otherness. And the effect of present has something to do with the impossibility to incorporate this presence as something uh, which will be my possession, which I can incorporate as mine. It will always be an excess, something that is, how do you say, annoying, something that is disturbing. And this disturbance is what life is important in life, to be astonished, to be always moved of something uncomfortable, but very important to give strength to the life, to our life. If you have always something you know already, but maybe a little bit different, it's not so exciting as when you are expecting something you don't know, will disturb you and will open windows, new windows, and maybe lead to fallen walls. You have to have fallen walls of knowing to be able to know, to discover.
But we would need a new metapsychology in order to bring into our area of observation this other part, which is that of the presentation, not of what we already know, or the representation or the inner world that we have built. So this is something open. So this is for the future, or to go constructing in a long time,
Little by little.
little by little.
Well, time is running up. I present to you the last question. Can you describe the difference between narcissistic object relating, in which the otherness of the other cannot be tolerated, and the otherness of the other as understood in link theory? I read it again. Can you describe the difference between narcissistic object relation, in which the otherness of the other can't be tolerated, and the otherness of the other as understood in link theory?
I think this question is answer. The person who asked this question answer to herself.
It's to herself, yes.
He or she, I don't know, did it very well. There is a difference. I think she gave the answer. I don't know what you think, Elizabeth.
Yes, exactly. Because exactly in a narcissistic object relation, you're not able to see the other, or
Yes.
you see just a very little bit of the other, and that is very annoying, very frustrating, and generating an important conflict. So I think that in the same question, she's bringing, or he is bringing, the own answer. But of
Congratulations.
course, no, but of course, even in a narcissistic relationship, we cannot take that up to an extreme. There's always something of the other that comes in, and that is what is terribly conflicting. It brings in a very important conflict.
Yes.
It's very difficult to work with these couples, and you have to do a great work in trying to bring in the difference, and this takes a long time if they let you.
Well, we arrived to an end. Thank you very much for all these ideas that no doubt will form part of our future together. Thank you very much to the panelists and to all of you, the attendees that have followed us. We'll wait you in our next edition of IPA webinars. Bye.
Bye.
Thank
Bye.
you.
Thank you.